Our Allergy Immunology Fellowship Program is really unique in that our pediatric clinical experiences are really well balanced between both allergy and immunology. Not only do we have experts in different allergic diseases like asthma, food allergy, EOE, but we also have a really strong pediatric immunology program. We take care of lots of patients with rare and complex primary immunodeficiencies. And just having this wonderful balance between allergic diseases as well as taking care of patients with primary immunodeficiencies is a strength of our program. Hi, my name is Aisha Ahmed. I'm an assistant professor here at Lurie Childrens Hospital in the Division of Allergy and Immunology. I'm the assistant program director of the Allergy Immunology Fellowship Program at Northwestern and the director of the pediatric track. My role is to really oversee the pediatric Allergy Immunology Fellowship curriculum. I will be your go-to person when you rotate on the pediatric side, and I help with designing the clinic schedule and also making sure that you have a really well-balanced clinical experience when you rotate on the pediatric side. Lurie Childrens is ranked the best hospital in the state, and so you get to work with other specialists that are really top of their field and very knowledgeable. And the hospital also draws a lot of very complex children, and so we're taking care of very bread and butter allergic conditions, but also complex patients that can have other comorbidities. We are a Jeffrey Modell Foundation Center for Research and Diagnostics, and that's a really prestigious designation and really speaks to just how robust our immunology program is. We also have a lot of food allergy and asthma trials that are ongoing. We have a long-term survivor program where we take care of patients with primary immunodeficiencies who have undergone a stem cell transplant, and we follow these patients for several years post-transplant as we monitor for transplant-related complications. We also have a multidisciplinary clinic with rheumatology. You will have a very strong allergy immunology training experience, and along with that, you get to work with attendings that are involved in clinical and basic science research. Many of us are involved in medical education, and we have a wonderful collaborative environment that really, I think, is an ideal environment for training in our field. There's a commitment to equity, diversity, and inclusion at the institution. We are really mindful about how these issues impact patient care, and we are really very mindful in terms of hiring practices and just on a day-to-day basis how all of that translates in our interactions. When a fellow leaves our program, they're equipped to be successful in whatever path they choose to take. We've had fellows that have joined faculty appointments in other academic institutions, and they feel confident in being able to care for patients independently. We've had fellows that have gone on to have wildly successful research careers, and then we also have fellows that have pursued quality improvement or medical education. And whatever the path it is that you choose to pursue, we hope that during your time at Lurie Childrens in the Allergy Immunology Fellowship Program, we hope that we equip you with all the necessary skills. Thank you for considering our program. If you have any questions, please feel free to reach out to us, and we hope to hear from you soon.